Àwọn àtúnkí ń káàbọ̀ sórí ìkànnì Ẹ̀pẹ́ lọ́wọ́ ìkànnì tí ẹ ti kọ́kọ́ ọmọ gbogbo ṣe ń lọ ní ìlú Ẹ̀pẹ́ lẹ́ni ọjọ́ kẹsàn-án oṣù karùn-ún kí ìwọlé gómìnà wa gómìnà ìpínlẹ̀ Èkó gómìnà Babajide Olusola Sanwo-Olu káàbọ̀ sí ìlú Ẹ̀pẹ́ lẹ́ni tí àwọn ilé-iṣẹ́ kan tí ilé-iṣẹ́ mádàndófò tí a mọ̀ sí Custodian Insurance tí wọ́n ń ṣe àfilọ́lẹ̀ tí wọ́n sì ń fa ibi tí wọ́n kọ́ fún ìpè pàjáwìrì tí a mọ̀ sí Accident and Emergency Center tí wọ́n fà lé ìjọba ìpínlẹ̀ Èkó lọ́wọ́. Bákan náà ni wọ́n ń fà lé ilé ìwòsàn gbogbogbò tí ó wà ní ìlú Ẹ̀pẹ́, ìyẹn Ẹ̀pẹ́ General Hospital eléyìí tí ó ti wá di Federal Medical Center tí wọ́n ń fà lé wọn lọ́wọ́ pé gẹ́gẹ́ bí iṣẹ́ tí ilé-iṣẹ́ ọ̀hún gbé dání, ìyẹn Custodian and Allied Insurance, pé láti pé àwọn kọ́ eléyìí fún ìjọba ìpínlẹ̀ Èkó láti lè máa dáhùn sí ìpè pàjáwìrì àti ti ìjàmbá eléyìí tí wọ́n kọ́ sínú ọgbà ilé-ìwòsàn gbogbogbò ní ìlú Ẹ̀pẹ́. Lẹ́ni gómìnà ni wọ́n fara wọn ní iṣẹ́ ìgbọ̀nsẹ̀ ní akínfẹ́ránmọ ẹni ni wọ́n bá wá sí ìlú Ẹ̀pẹ́ lẹ́ni pé fúnra wọn ni àwọn máa gbé ìṣàkóso àwọn ilé wọn lọ́wọ́ kan náà tó wá gbélé àwọn tí aṣojú ìpínlẹ̀ Èkó lọ́wọ́. Gbogbo lẹ́ẹ̀kan ní ìlú Èkó àwọn náà ni wọ́n péjú pésẹ̀ síbi ayẹyẹ tèní. Ẹ máa bá wa bọ̀ gbogbo bí ó ṣe lọ.
This afternoon with a deep sense of fulfillment to officially hand over the newly constructed Custodian Accident and Emergency Center here inside the premises, the FMC in Epe. Proud to witness yet another milestone in our journey towards the delivery of quality, accessible, responsive healthcare service across to this position. I think on your behalf, Custodian Investment Limited and all of their companies, they truly deserve a big round of applause. Please let us give them a big round of applause. Your dedication and giving back to the community is exemplified by the undertaking and completion of this noble project. I want to also commend our Ministry of Health, who could work with you very collaboratively, very easily, and to ensure that we're able to implement this project on time with all of the required expertise and ensuring that we deliver world-class facilities. This center stands as a symbol of what is possible when vision, planning and execution all align together. This administration is setting a new benchmark in fulfilling its promise of infrastructural and social responsibility. Today's commissioning of the Accident and Emergency Center, we believe, is a bold step forward at expanding access to urgent needs and life-saving medical services, especially outskirts of the main Lagos area. Like the MD of Custodian, but they thought of a better option to approach the Lagos State government, and they didn't come with a mindset. The fact that they can sit with us and we can jointly look at it and look at the best position to put it goes to show that the prayer is always in our mind. We'll always remember you. I will not mention the other areas that we have gone to, since you know that we have 5 divisions, but it was strategic, knowing fully well what are the other investments that are all around here. And so for us, is to ensure that every part of our state, every division in our state, we look at it and we're very objective to be able to work with either our partners that are donating or even as a government to say that this investment is best suited for this neighborhood, and that's what we're going to do. So today, it's the turn of Epe Division, it's the turn of all of us that are here. So what you owe us is just a debt of gratitude. To say that other divisions that probably will have also wanted to benefit from this is here right now in Epe. And so probably it is your own. You have seen it. It is your own. It is to be able to keep your people safe. This facility, like they said, is a level 4 tier facility that will triage and stabilize the event of an accident. It's difficult for us to say that this is when accident is going to happen. We don't know. But a facility, a world-class facility like this, will ensure that when it does happen, you have a place where you can bring them in first to quickly stabilize people. And it's always that first 24 to 48 hours, sometimes that is critical at stabilizing life. And so what it will do is to be able to analyze what needs to be done on a medium to a long-term basis. But at least the first thing is that life has been saved, we've been able to preserve life, and we'll be able to now take it forward to know what additional level of medical facility will be required. So it's a well thought out process. It's a well thought out process to ensure that the objective of custodian investment itself, like they said, they started the company like an insurance company, they pay back, insurance premium and rest of it. But beyond that, is to be a socially responsible organization that now wants to take that message beyond just providing one arm, but look at the entire ecosystem of ensuring that life can be saved, we can have a better economy, and we can have a better social economic development in our various cities and states. And we believe this fits very well with the objective of our government. And like it's also been explained, there are several facilities that are there. Once we go in, we can see it. My advice is that as we are handing over this to you, right, let us see it as another public asset that we need to preserve and we need to protect. We need to ensure that we protect and we preserve it. It is a facility that has been built and has been built well. Let's ensure that we come in here and we utilize all of the staff that are going to be working here, all of the support, medical, first responders that are going to be working here will be well trained, will be well motivated, but to ensure that there is a synergy between the patient and medical staff. Everybody has a role and responsibility, that comes along with this. So, ẹ máa bá a tọ́jú ẹni o, a tó di pé aṣọ ìbò tó pọ̀ jù, kábíyèsí ṣẹ́gbọ́, ó ti di nǹkan tíjọba kan gbé wá àgbègbè yìí tí àdúgbò àti ìlú yín lẹ́bẹ̀ẹ́ bì pé a rí pé a ṣe ìtọ́jú tó yẹ àti tó fún rúbí báyìí lágbára Ọlọ́run èmi tó bá wá sínú bí ayé o kò ṣe pé bóyá a fẹ́ kí nǹkan ṣẹlẹ̀ sí wọn ṣùgbọ́n a gbọ́dọ̀ gbé ètò sílẹ̀ láti rí i pé tó bá wá sírú hospital báyìí tó jẹ́ pé òun máa kọ́kọ́ yẹ̀ wọ́n wò pé kí nǹkan tó ṣẹlẹ̀ gangan ibo gangan náà kọ́ lọ ṣé tẹ́lẹ̀ gbogbo ni o àbí talára ni àbí tẹ́lẹ̀dọ̀ ni ìyẹn ló máa jẹ́ kí wọ́n mọ irú ètò owó gangan náà máa ṣe fún wọn tí ẹ̀mí máa fi dáàbò bo ẹ̀mí tí ò lè jẹ́ pé bóyá ẹ̀mí máa lọ sí. So mo fẹ́ dúpẹ́ lọ́wọ́ yín ṣùgbọ́n pàápàá jùlọ mo fẹ́ dúpẹ́ lọ́wọ́ àwọn ará wa tó ń gbèrú ilé ìkàlẹ̀ àjọ̀dọ̀ ṣe kẹ́rí pé ó ìbọn tó yẹ pé ó wúyàn lórí ni ó dẹ̀ dùn mọ́ wa nínú pé inú kan báyìí Ẹ̀pẹ́ láti bẹ̀rẹ̀ tó di dandan pé kẹ́ bá wa tọ́jú ẹ̀. Distinguished guests, ladies and gentlemen, what we're also expressing, especially to other corporates like Custodian Investment, is that when you see and understand that an investment is socially inclined investment like this, your government in Lagos State is always willing to work with you. Our communication and information out there is to all other corporates who either to in one form are still not so sure of how well they can bring about their support to government. Our government will ensure that whatever it is that you want to do with us, whatever it is that you want to do for the people, for the citizens, we are willing and we are ready to work with you. We'll ensure that do not waste your time, will ensure that we do not waste your resources, will ensure that your targeted intervention will meet the required audience at all times. And that's why we're making this solemn pledge at all times, and we're using the point of contact of what Custodian has done for us today to call another socially inclined corporate organization to come forward and let us partner. Government cannot do everything all by itself. Government will continue to provide and use best endeavors and resources to provide adequately for the citizens, but we're all in this together. We're all the same coin, we're just two different sides of the coin. And so we're happy that Custodian has taken the lead on this. We're willing to work with other practitioners and other players. To all of the professional staff that will be working here, doctors, nurses, medical staff, who will take up this facility, your role, you know, it's invaluable. We deeply appreciate your dedication, and we know that you continue to pledge your continuous support for facilities like this. Our government will continue to ensure that you receive the required training, you receive the required welfare and professional development for you to carry on your noble duty. It's also important for us to thank the construction company, the architect, Ministry of Works and Infrastructure, and all stakeholders that have been part of this, that indeed you've done a great job, and we're indeed happy for you. To the residents of Epe and its environs, like I said earlier, we encourage you to take full ownership of this center, use it well, protect it, and support the staff to ensure that it remains a beacon of hope and an organization and health facility that will outlive generations behind us. As we hand over this facility today, I urge you all stakeholders, community leaders, health professionals, residents to work together and ensuring that the center fulfills its purpose and enhance the well-being of our people. Together, we believe that we're building a Lagos where health, safety, dignity are guaranteed. And I want to once again assure you all that this is just another one level of support that PPP can work with government and the private sector. There are several other levels in health, in education, in tourism, in infrastructure that we can continue to develop together. I want to thank you very much for being part of this event. I thank the Managing Director of Responsibility, Custodian, Responsibility, Social Responsibility Foundation, Custodian. Thank you very much, Madam. Thank you all our partners that are part of it. Thank you all our community leaders, and hope to see you yet in another event. Thank you very much. I'm really actually the Honorable Commissioner for Health and the Special Advisor of Health for putting all of this together. The body of Permanent Secretary, especially the Permanent Secretary in the Ministry of Health.
Sorry, bro. Sorry, sir. Officer, I beg, no better, sir. Thank you, sir.
Thank you very much, gentlemen of the press. To the glory of God and to the benefit of mankind, especially all of our residents, our citizens in Epe and its environs, we hereby dedicate and hand over the Custodian Accident and Emergency Center here in Epe for our citizens and for the benefit of all patients that will come here. They will be tried, they will be well, and they will go home, with a better resounding health. Thank you very much. Thank you. Thank you. Watch your back. So the patients arrive in the ambulance and we have both two casualties like we have all of them can be brought in there. And based on how serious the emergency is, they can be brought in. And then we have the observation work. Okay, so you can actually use the right of the ambulance effectively. Right. So at the end of the day, at the end of the day,
grateful and we are happy, and we want to say a big thank you to Mr. Governor, because through the health ministry, and they facilitate this to our local government. So it's an applaud to Mr. Governor. So I want to say thank you to him, and thank you to our medical team as well. At least this is a fantastic job, and it will help us in our community.
Your advice on usage of this?
Yes, the thing is, the most important thing is always make sure there's a touch on it. Always make sure there's a touch. So that will enable you to look more even decent as it is, rather than us abandoning the project, or maybe not doing what is expected of us to keep it up, or to make sure that all these facilities are in good condition. That's the most important thing. So there should be somebody that will be in charge of servicing and all other things and maintenance for these facilities. Thank you very much.
I just want to make a few remarks regarding these projects that we're handing over to Lagos State today. The Custodian Foundation essentially intervenes in three major areas: the area of health, education, and community service. We do continuous impact around our community area Yaba and the Lagos environment as a whole. Lives, which is also associated with access. And that was how this whole idea started several years ago. We had a journey, an initial journey which didn't work. We tried to establish along the Lagos Ibadan Expressway, looking for a location where we could, place the center, but it didn't work. We were sagging, and then came back to the drawing board again, and then it occurred to me that the commissioner for health in Lagos State is my brother, is my big boy. He was my senior in school. So I called him up and I said to him, I'd like to see you. He said, come over. I got into his office and I told him what we wanted to do. And he explained to me that he saw bang right in the center of division, part of the vision for health in Lagos State, establishing trauma centers and accident and emergency centers across the states. So he opened up his computer. I said, look, we want Lagos Ibadan Expressway. Before he opened his computer, I was looking at it, because Lagos is way ahead of other states. If I can say, in terms of, because they are dealing with civil servants in Lagos and they think you're in the private sector. So when he opened his computer, the next thing he went into Google app and started bombing Lagos Ibadan Expressway. And he said, you see, there's no space here. But there's availability, around the area of Epe. And he spotted one or two places. I said, maybe we could place it here. He eventually ended up in this location because of the ease of moving trauma patients from here to the hospital. So he said, look, it would be better you place this in the premises of the hospital. And that was how this journey started. He said, for one thing, I'll have to get the go-ahead from the excellency itself. I think he called me within 24 hours of putting that and said, Mr. London, go-ahead. And that was how it started. That was how it all started. And a team was formed, and we do, regard to our own team, Babajide who is the MD of Social Responsibility Foundation, and the commissioner set up a team in health, and that was it. We did the ground breaking, I think, in 2023, and here we are today, with a fully complete building. The details of which, of course, maybe Gumi coming after me will speak to, but I want to specifically just thank all those that have been involved, one way or the other, in this whole project. Of course, I've mentioned the governor, and I would also mention, and please forgive me if I don't mention your name, I'd also mention, of course, Sam was very helpful, at various times, trying to get the governor into it. Professor Abaomi, I can't thank you anymore, you've done so well, very passionate about it. Mrs. Kelly Oguyemi, also very involved in the matter. Dr. Sheku Ogwe, the FAMSEC, thank you very much. Dr. Otuole, Dr. Arobudade, I think Dr. Kaka, who is the present MD of this environment, and Dr. Olusola Sanwo-Olu, who was the former managing director of Epe Medical Center. I mean, it's been all great, and there have been so many people working behind the scenes, that I haven't mentioned, that have done so much ensuring that this project comes to pass. But I'd like to mention the guys that put it up, because this is their moment. It's also a way of letting them know, Mr. Governor, maybe Mr. Governor will remember this in contract. So I'd like to also recognize the contractor, Engineer Shola, of the Monumental Construction Company. I don't know where he is, I know he's somewhere here. They put up this structure and they were able to finish it in time. And then, of course, the architect, who is a smart young gentleman, Donapo Fanola of UCA Architects. I'd like to recognize his presence. He's done very well, in putting this up, as you can all see. So I want to thank you all for the cooperation that you've given to us. We are encouraged that our first, quasi PPP experience has been good. So it's encouraging for us to move on to the next level and find other things that we can partner with with Lagos State. Lagos State is a good template. They've done, extremely well, and we really look forward to doing more businesses and collaborating with Lagos State. So thank you very much, and thank you, Mr. Governor, for taking time out of your very busy schedule. Thank you.